Alcohol and drug addiction can hurt an entire family as well as a support group. It's serious. That's why there are places that can help. The Coliseum Center for Behavioral Health is one of those places. I sit down with the social services coordinator for a deeper look. We're here with Don Tillman. He is the social services coordinator for the Coliseum Center for Behavioral Health. Don, thank you so much for being here today.
You're welcome.
All right, today, Don, I want to talk a little bit about alcohol and drug recovery. That's what you guys primarily do there at the Behavioral Health Center, and I know this is something that you're obviously passionate about. You love helping people. First off, I guess the question you get a lot is, how do you know when somebody needs to go to rehab? What are some of those signs? How do you identify that?
Well, I do get that question a lot, and there's a number of indicators of things that you can see that are going on with the person that may indicate that they're using alcohol and drugs or abusing alcohol and drugs. Some of the things might be missing work, irresponsible behavior, of course, bizarre behavior is another indicator that a person may be using drugs. Or there may be more subtle things that family members may notice and that kind of key them into something might be going on with that individual.
And I think it's really a tough situation to be in with someone maybe that, and you probably encountered all the time, somebody that doesn't want to go into rehab, doesn't think that they have a problem or something like that. What advice would you give at family members who might suspect something but don't really know how to approach that person?
One of the things that I often tell family members that I think family members are often it's very difficult for a family member because they're close, because they love the individual. It's difficult for them to be objective. It's difficult for the family member that has or may have a problem to hear what they have to say. So they may need an intervention from an outside source. So I encourage family members to try to get them to an assessment center or some professional that can be objective and look at it from an objective standpoint. It's a little easier for the individual to face that issue with someone that they don't know.
That makes sense. What do you guys do for patients once you get them into the program? Obviously, it's a very complicated program, but what are some of the main things you guys try to foster there?
Well, at Coliseum, we are assessment and referral. We have an assessment and referral center, so we do the initial assessment and referral through our Lifeline services. And then we also offer alcohol and drug detox, which is usually a 5 to 7 day process depending on the substance that they're abusing. And we also have crisis stabilization for psychiatric treatment and inpatient treatment. We're not a rehab facility per se, but we do try to help individuals get into rehab if they want to go further to treat their alcoholism and drug addiction.
And if we want to get in touch with you guys, if we think maybe we've got a problem with one of our family members or somebody we know, how can we do that?
We have, as I mentioned before, we have the Lifeline Assessment and Referral Center at 741-1355 locally, or 1-800-542-4221 is the 800 number for Lifeline, and it's staffed 24/7. And anybody that can call in at any time. We do assessments on a walk-in basis and also by appointment, either one.
Awesome. Well, Don, thank you so much for being here today. A lot of good information out there to give people hopefully a little bit of help.
You're welcome.
So much.
Thank you.
Awesome. If you need more information about what Don does over there with the program, you can visit 41NBC.com. We'll have all the information there on our website.